Welcome to Save a Life in 1 Hour, a first aid course taught by real paramedics. In this module, you will learn how to treat a patient who is choking. Choking is a life-threatening condition. When we talk about choking, we talk about two different types of choking. The first one is called partial obstruction, a partial blockage of the airway. The second type of choking is known as a full obstruction. This is when something is blocking the airway completely. A good example of a partial obstruction would be choking on a little bit of food like a chicken bone, or sometimes when you drink water and it goes down the wrong way, that's a partial obstruction. The body's natural reaction to a partial obstruction is to cough. Think about the last time you drank water and it went down the wrong pipe. You started to cough. We need to encourage them to cough. Tell your patient to cough. Try to cough it up. Big coughs. Big in and out. The second type of choking is known as full obstruction. This is when something completely blocks the airway. This is a life-threatening emergency and we need to act quick. The way to tell a patient has a full obstruction is there will be no air moving. They won't be able to scream, they won't be able to cough because no air can get into their lungs. A patient who has a full obstruction will no longer get any oxygen. Their lips will turn blue and their face will turn pale. Look at the patient's lips and even the sides of his nose. What we need to do is get the patient to bend forward. Use gravity, get their head between their legs. And then we administer 5 sharp back blows using the palm of our hand between their 2 shoulder blades. 1, 2, 3, 4, 5. In between each back blow, make sure you watch to see if the obstruction comes out. If the obstruction comes out, don't give the next back blow. If the 5 sharp back blows don't work, sit the patient up. Give them 5 chest thrusts. Use the palm of your hands in the middle of their chest, right on their sternum. Push hard. 1, 2, 3, 4, 5. If this doesn't work, get the patient onto the ground. We'll alternate between back blows and chest thrusts on the ground. Just like C in our 7-step action plan, compressions, it's the same location that we do the chest thrust, right on the sternum. Use the palm of your hand and give 5 sharp chest thrusts. 1, 2, 3, 4, 5. If this doesn't work, roll them onto their side. Give them 5 sharp back blows, just like before, watching to see if the obstruction comes out. Alternate between your back blows and your chest thrusts. If the patient loses consciousness, this is now classified as a cardiac arrest. Continue chest compressions. If you have access to a defibrillator, get a defibrillator. Keep doing this until the patient either starts breathing or help arrives. The first aid for choking in babies follows the same principles as adults. If a baby has a partial obstruction, so only part of their airway is blocked, then encourage coughing. Remember, in a partial obstruction there will be air moving. They most probably will be coughing already. Encourage it. Try to get them to cough it out. If the baby has a complete obstruction, meaning that the airway is completely blocked, there's going to be no air moving. The baby won't be crying, they won't be making any sound. They'll turn pale in the face and blue around the lips. Utilize gravity. Heads down, bottoms up. Administer 5 sharp back blows. Try to aim your back blows downwards. 1, 2, 3, 4, 5. Remember, your back blows are between the shoulder blades. Also remember to watch to see if the obstruction comes out of the baby's mouth. If this doesn't work, we need to get them onto the ground and give them 5 sharp chest thrusts. Place your 2 thumbs on the baby's sternum. Put your fingers up under their armpits and push down hard 5 times. 1, 2, 3, 4, 5. Remember to watch to see if the obstruction comes out. If it comes out of their mouth, stop doing the chest thrusts. If this doesn't work, we need to alternate back to our back blows. Remember, heads down, bottom up. 5 sharp back blows, aiming downwards. If this doesn't work, again, place the baby on the ground. 5 sharp chest thrusts. Continue to alternate between back blows and chest thrusts whilst the baby is conscious. As soon as the baby loses consciousness, it's a cardiac arrest, which is C on our 7-step action plan, compressions. Continue compressions. Remember, do compressions at a rate of 100 a minute. You're better to go too fast than too slow. Keep going until help arrives or the patient starts to breathe again.